So now we shall be discussing regarding the anatomy of the infratemporal fossa. Okay, so our topic of discussion would be the anatomy of the infratemporal fossa. So it would be infratemporal fossa. So if you look at infratemporal fossa, first of all, where is this infratemporal fossa? So this guy, he's poking his finger into this particular part. This particular part over here is nothing but called as your infratemporal fossa. Okay. For example, if you look at the skull, okay, now this part is called as a zygomatic process. Okay, now if I'm putting my finger into the zygomatic process inside like this, so the place where my finger is resting right now is nothing but called as your infratemporal fossa. So this is your infratemporal fossa. Let us see what are the borders of this particular infratemporal fossa. Okay, so this particular part over here is called as your infratemporal fossa. Now, if I have to write one very important point, what will I write? Where is this first of all present? This infratemporal fossa is present behind the zygomatic arch or in front of the zygomatic arch. It is present behind the, you see, the finger is going behind or deep to the zygomatic arch, right? So this is located deep to the zygomatic arch. Okay. And another important thing you need to know is that this infratemporal fossa is associated with pterygopalatine fossa. So already we have recorded a video on pterygopalatine fossa. Okay. So this is associated with pterygopalatine fossa. Okay. So there are two important things you need to know. What are those two important things? One is it is located deep to the zygomatic arch, and second is it is associated with the pterygopalatine fossa. So these are the two important things which you need to know. Now apart from these two important things, let us see what are the borders here, right? So if I have to look at the borders, right, for example, let us say that this is your infratemporal fossa here. If I wanted to look at the infratemporal fossa clearly, what should I do? I have to remove this zygomatic arch. I have to break open this zygomatic arch so that I can look at the infratemporal fossa very clearly. So after breaking open the zygomatic arch, you see, this was the place where your zygomatic arch was present in this way. Okay, so we have removed the zygomatic arch. So what are the different borders you can see over here? First of all, where is your infratemporal fossa? See, this part which I am showing it to you right now, over here is what is called as your infratemporal fossa. See, this part over here is called as your infratemporal fossa. Okay, now in this infratemporal fossa there are different parts. For example, there is superior border, there is inferior border, right? Superiorly we have got some structures, inferiorly we have got some structures, posteriorly we have got structures, anteriorly we have got structures, laterally and medially also. So there are many borders: superior, inferior, posterior, anterior, lateral as well as medial. So in this we can see all of them over here. First of all, when I tell superior, this yellow color bone which you can see is superior. When I tell posterior, this yellow color bone on the back is called as posterior, right? So let us see what are the superior as well as what are the inferior borders. For example, let us start with the superior border. See, this particular border which I am drawing right now, this particular border over here is called as your superior border. So superiorly what do you have? What is this bone? So superiorly what do you have? Superiorly you have got this particular bone. This is called as a greater wing of sphenoid, or this is called as a great wing of the sphenoid bone. So this is called as a great wing of the sphenoid bone, right? Now after the superior border is done, let us concentrate on the inferior border. See, this dot which I am putting over here, this one, you see, this one over here is called as your inferior border. What is this inferior border made up of? Inferior border is having the pyramidal process of the palatine bone. Okay, so what is this? This is a pyramidal process of palatine bone. This is called as the pyramidal process of the palatine bone. So this process is called as a pyramidal process of your palatine bone. Okay, where is this present? This is present inferiorly. Okay, next, anteriorly what do you have? See, anteriorly this is a structure that is located. So what is this structure which you have got anteriorly over here? Anteriorly this bone here itself is called as a maxilla. Now tell me, if I divide the maxilla into two halves, this is called as the anterior half of the maxilla and this is called as the posterior half of the maxilla. So anteriorly what do I have? Anteriorly I have got the posterior half of the maxilla. You see this part over here. So this part over here is called as your posterior surface of maxilla. This part here is called as a posterior surface of maxilla. Posterior surface of the maxilla, right? Next, posteriorly what do you have? Anteriorly, that is posterior surface of the maxilla, right? Posteriorly what do you have? What is the posterior border? See, this bone which is located over here is a posterior bone. It is also yellow in color, right? So what is this particular bone over here? This particular bone over here is called as your pterygoid process, right? So posteriorly we have got pterygoid process. Posteriorly we have got pterygoid process. Okay. Next important thing is that what do you have medially, right? You see this blue color thing in the center here, right? So this blue color thing which you can see in the center, right? Center of what? Center of infratemporal fossa. Okay. Exactly in the center of infratemporal fossa you see this blue color thing. This forms the medial wall. Okay. So medially what do we have? Medially we have got a structure that is called as a perpendicular plate of palatine bone. Okay. So we have got perpendicular plate of palatine bone. You have got perpendicular plate of your palatine bone. So what is this structure located? This structure is the medial structure, right? Now what is the structure that you have laterally, right? So laterally I cannot show it to you here, rather you can see here, if you clearly look, you can see at this structure. You see this particular structure here, right? So this is the lateral border. You might think this is a superior border, but no, this is the lateral border. Okay. So in this picture you cannot see. Actually, if you are looking from the front or from the back, you can see that it is a lateral border. So even if you are not finding it that this is a lateral border, for instance, I will show it to you later on, right, that picture in a 2D 3D image. But for now what you need to know is that you just write it down that the lateral border is having pterygomaxillary fissure. Okay, so it is having pterygomaxillary fissure. Pterygomaxillary fissure. So let us revise all these things. Okay. So what is the anterior border over here? So first of all, let us discuss about the superior border. So greater wing of sphenoid, right? So this greater wing of sphenoid, whatever is there, this forms the superior border. Okay, greater wing of sphenoid forms the superior border. Next, after that, inferiorly, what it is having, inferiorly you have got the pyramidal process of the palatine bone. So this forms the inferior border. So inferiorly we have got what? We have got the pyramidal process of the palatine bone. Anteriorly what do you have got? Anteriorly you have got the posterior surface of the maxilla. This is present anteriorly. And posteriorly what do you have got? Posteriorly you have got the pterygoid process. So this is present posteriorly. This is present posteriorly. After that, laterally and medially what do you have? So this part over here which is located perpendicular plate of the palatine bone, right? So this perpendicular plate of palatine bone is located medially or laterally? This is located medially. I will write all these things again medially. And this one is located laterally. So let us just revise all these things here. Okay. So what are the structures that are located superiorly? Superiorly. What are the structures that are located inferiorly? So what is the structure that is located anteriorly? What is the structure that is located posteriorly? Okay. And what are the structures that are located medially and laterally? Medially and laterally. So what are the structures that are located medially and laterally? So let us look at all these important structures. So superiorly what do you have? Inferiorly what do you have? Anteriorly, posteriorly, medially and laterally what do you have? Okay. So first important thing is that superiorly I have got greater wing of sphenoid. So I have got greater wing of sphenoid. Now here Here if you are confused with the greater and lesser wing of sphenoid, okay. So in a lecture of middle cranial fossa, there I have clearly explained what is the greater wing of sphenoid, what is the lesser wing of sphenoid, okay. So there you can watch this. So this is a greater wing of sphenoid. Next, after this greater wing of sphenoid, inferiorly what do we have? Inferiorly we have got what? Inferiorly we have got the pyramidal process of the palatine bone. What do you have? You have got the pyramidal process of the palatine bone. Pyramidal process of the palatine bone, that is located inferiorly. Next, anteriorly what do you have? Anteriorly you have got what? The posterior surface of the maxilla. Anteriorly you have got the posterior surface of the maxilla, and posteriorly what do you have? Posteriorly you have got the pterygoid process, okay. Posteriorly you have got the pterygoid process. Posteriorly you have got what? You have got the pterygoid process. Now what is the structure that is located medially and what is the structure that is located laterally? These are only the two confusing things, right? So I'll show it to you in a 3D image. But in fact, the medial structure is this blue color structure which you can see, that is a perpendicular plate of the palatine bone, okay. So medially and laterally we have got, one is called as a perpendicular plate of your palatine bone. Perpendicular plate of your palatine bone. So what is that located? That is medially located. And laterally what do we have? Laterally we have got the pterygomaxillary fissure. Laterally we have got pterygomaxillary fissure. So that is located laterally, okay. So these are some of the very important structures, right, which are related with the infratemporal fossa. Now another important thing is that you should also know that there are very important muscles that are in association with this, the infratemporal fossa. What do you mean by muscles association with infratemporal fossa? Which mean that exactly at this particular area, okay. So exactly at this particular area there are some muscles that are attached. That is why I am calling it as these muscles are in a relation with this infratemporal fossa. So these muscles which are attached in this region, obviously this is the region of your mastication, right? So all these muscles which I will be telling you right now are the muscles of mastication which are in association with what? Infratemporal fossa. So let us write down the muscles that are in association with the infratemporal fossa. Muscles in association with infratemporal fossa. Okay, so what are the muscles that are in association with the infratemporal fossa? Now, first of all, I have to tell that not all, right, but whatever muscles I am telling you, all of these muscles are the muscles of mastication. Muscles of mastication, okay. So muscles of mastication are in association with the infratemporal fossa. Now what are the muscles of mastication over here? See, for example, you can very clearly look at this muscle over here, and you can also very clearly look at this muscle. These two are called as lateral pterygoid muscles. Now one lateral pterygoid is on the top, one lateral pterygoid is on the bottom. So the lateral pterygoid which is on the top is called as the superior lateral pterygoid, and next is one called as the inferior lateral pterygoid. So the upper one is called superior head of, right, so the top one is called as superior head of lateral pterygoid, superior head of lateral pterygoid, and next one you got is the inferior head of lateral pterygoid. Inferior head of lateral pterygoid. Inferior head of your lateral pterygoid, right? Now, when I tell lateral pterygoid, there should also be muscles like medial pterygoid. So down also you can concentrate on two important muscles over here. You can see this particular muscle and you can see this red color muscle as well. So this red color muscle, whatever you can see over here, is called as the, what is this? These two muscles, the red color and the brown color muscle, these two muscles are again, these are not lateral pterygoid, but this time these are called as medial pterygoid muscles. Now in this medial pterygoid also, there is no superficial and there is no superior and inferior. Instead of that, there is something called as superficial and another one is called as deep. So this red one, whatever you can see, is called as the superficial muscle. Superficial head of, this time it will be what, lateral or medial pterygoid? Medial pterygoid. Superficial head of medial pterygoid. Okay. Next here we have got the deep. Okay. This is called as a deep head. Deep head of the medial pterygoid. So how many heads of the lateral pterygoid we have got? We have got two important things. One is called as the deep head of the medial pterygoid. Another one is called as the superficial head of the medial pterygoid. And up here we have got the superior head of the lateral pterygoid and the inferior head of the lateral pterygoid. Okay. So these are the four muscles that are in association with the infratemporal fossa. Clear? Right? Now what we will discuss is that what are the contents? What are the nerves that are passing through this infratemporal fossa? Why this infratemporal fossa is important? Because we have got some very important nerves and arteries. Okay. So let us discuss what are the nerves that are passing through this infratemporal fossa. So just remember by this mnemonic called as MACO, MACO. Okay. So what is this? M stands for your mandibular nerve. Okay. So what does M stand for? M stands for your mandibular nerve. What is your mandibular nerve? Mandibular nerve is a branch of which cranial nerve? That is fifth pair of cranial nerve, which is also called as your trigeminal, right? So it is a branch of trigeminal nerve. Trigeminal nerve. Now mandibular nerve is V1, V2 or V3? It is V3. Mandibular nerve is V3. All of you know that ophthalmic branch of trigeminal nerve is V1, maxillary branch of trigeminal nerve is V2, mandibular branch of trigeminal nerve is V3. Okay. Next, what does A stand for? A stands for auriculotemporal nerve. Auriculotemporal nerve. Then now, auriculotemporal nerve is a branch of what? Actually, auriculotemporal nerve is also a branch of trigeminal, but these mandibular and all, this is the motor branches. Auriculotemporal nerve is a sensory branch of trigeminal nerve. So it is a sensory branch of trigeminal nerve. What is this? This is a sensory branch of trigeminal nerve. Now after this, the next important thing over here is chorda tympani. What does C stand for? C stands for chorda tympani. C stands for chorda tympani. And finally, O stands for otic ganglion or otic ganglion. Otic ganglion. So, what are the nerves that pass through the infratemporal fossa? The first important thing is this nerve, that is your mandibular nerve. Okay. Next important thing is your auriculotemporal nerve. Third is your chorda tympani and fourth is your otic ganglion. So, these are the four important structures that pass through where? That pass through this infratemporal fossa. Now, after the discussion of nerves is done, we shall discuss what arteries are also supplying this region or what arteries they pass through this infratemporal fossa, right? Now, let us look at these. So, I will come back to these pictures, these cadaveric images later on. So, first of all, let us see what are the branches over here, which are exactly supplying your infratemporal fossa. For example, if you look here, if you look at this picture, you see this picture, in this picture, here let us say you have got your ear and let us say this is your mandible over here. Okay, let us say this is the cut section of your mandible. Now, this artery which I am drawing right now over here is your external carotid artery. So, this artery over here is called as your external carotid artery. This external carotid artery I have discussed in detail, okay. But now what I am trying to tell you is that I will just draw two branches of external carotid artery. One branch of external carotid artery goes up, right. Now where is this branch present? This branch is present in between your ear, in front of your ear and behind your mandible, right. So this is your ear, in front of your ear and behind your mandible, which means exactly this area, right. So at this area, if you are putting your fingers, right, you can actually feel a pulsation of some artery. That artery is nothing but this one. So the branch, the name of this artery over here is called as superficial temporal artery. Superficial temporal artery. Superficial temporal artery. Now, is this superficial temporal artery part of the part of the infratemporal fossa? Now, where is your infratemporal fossa located? Your infratemporal fossa is somewhere over here, right? This is superficial temporal artery, which is above that. So, we are not discussing about this, but what are we discussing is, you know that your infratemporal fossa is somewhere here, right? Now, into this you see an artery that is a branch of external carotid, okay. You see, this is your external carotid artery. A branch of external carotid is entering into the face in the maxillary region. This artery you call it as maxillary artery. So this artery you call it as maxillary artery. So can I tell maxillary artery is right now in the infratemporal fossa? Yes. So can I tell that the arteries, what are the arteries that are associated with the infratemporal fossa? So can I write it down in the list that the first artery is your maxillary artery. Maxillary artery. After the artery, next we should also discuss about the vein. So maxillary vein. Maxillary vein. Not only maxillary vein, third important thing you see is middle meningeal vein also. You even have got middle meningeal vein. Now, apart from this middle meningeal vein, the last important thing you have got over here is a plexus, and this plexus in the pterygoid region is called as pterygoid venous plexus. Pterygoid venous plexus. You might be thinking, what is pterygoid venous? What is a plexus, right? So over here, there are a lot of pterygoid veins, right? So these pterygoid veins join together to form a plexus called as pterygoid venous plexus. Okay, right. So what is this artery, by the way? This is external carotid artery. So if I ask you what are the branches that are associated with the infratemporal fossa or passing through the infratemporal fossa, what will you tell? What are the branches? One is called as your maxillary artery, another one is called as your maxillary vein, next you have got the middle meningeal vein, next you have got the pterygoid venous plexus. So these are some of the very important structures that are the contents of the infratemporal fossa. Okay, let us look at these branches over here. Now exactly compare this picture, right? Compare this picture with this picture above, or else let me just copy paste that image over there. Right, now compare this picture with this. So where you can see the superficial temporal artery. So can I show it to you that exactly here? Yeah. So this is the place, you see this place over here. You see this artery which is entering into the temporal region. All of you know that this is your mandible. All of you know this is your ear. Behind the mandible, in front of the ear, you see this particular artery that is going up, right? So can I tell that this artery is called as superficial temporal artery? So this artery over here will be your superficial temporal artery. Okay, so this particular artery is superficial temporal artery. Okay, after the superficial temporal artery, look at this particular. Superficial temporal artery is a branch of what? External carotid artery. You see this particular segment is called external carotid artery. Look at the picture here. You see external carotid artery which is shown in the picture. You see this? This is your external carotid artery. From external carotid artery, which artery should come out? Superficial temporal artery. See, you see this superficial temporal artery here. You see it is passing up like this, right? So this is a superficial temporal artery. Fine. Next, You also told me that there is another artery here. This artery is by the name maxillary artery. Where is this maxillary artery? See here. If you can very clearly see that if this is, see this particular part is your external carotid artery is giving branch that is passing all the way like this. You see this branch over here is nothing but called as your maxillary artery. Okay. So maxillary artery is a part of what? It is a part of what? It is a part of your infratemporal fossa. Okay. So maxillary artery is also a part, right? Clear? So let us just discuss the things which we have spoken just now. We discussed few important things. For example, point number 1, right? We discussed that this infratemporal fossa is located deep to the zygomatic arch and it is associated with our pterygopalatine fossa. Next, it is having few important parts. Superiorly, it is having greater wing of sphenoid. Inferiorly, it is having a pyramid, right? Pyramid of what? Palatine tonsils. Next, we have got the posterior surface of maxilla. Next, we have got the pterygoid process. They form the anterior and the posterior border. Medially and laterally, what do we have? Medially, we have got the perpendicular plate of palatine bone, and laterally, we have got the pterygopalatine fissure. Right? So, these are the borders here. Next important thing is that the muscles that are associated with the infratemporal fossa, these muscles are called as muscles of mastication. Okay. Next important thing, what are the different muscles of mastication? Here we have got the superior head of lateral pterygoid, we have got the inferior head of lateral pterygoid, we even have got the deep head of medial pterygoid, we have got the superficial head of medial pterygoid. Okay. So, lateral pterygoid and medial pterygoid are the muscles that are in association with the infratemporal fossa. In the lateral pterygoid, one is superior, inferior, medial, one is deep and superficial. Coming to the nerves are MACO. So, M stands for mandibular nerve. Okay. A stands for auriculotemporal nerve, which is a sensory branch of your trigeminal nerve. C stands for your chorda tympani and O stands for your otic ganglion. Okay. Right. So, these are the branches over here, and coming to the arteries that are in association or that are passing through this infratemporal fossa, maxillary artery, maxillary vein. Next, we have got the middle meningeal vein and pterygoid venous plexus. Right. So, these are some of the very important things which you need to know regarding the infratemporal fossa. So, thank you so much for watching my video. Goodbye.